Open your eyes. Hold your arms up nice and strong. Keep
This man is a doctor, and we can tell you his name. David Blacker, Medical Director, Perrin Institute, Perth.
Just relax your jaw, let it hang loose.
His dad was a teacher, his mum a housewife. And as it appears there are no recent medical genes in the family, how did this neurologist come to be?
Hold up like this. That's it.
One influence might be Freud's interpretation of dreams, which the teenage Blacker got from the library to read. And then there was a television program that might fairly be described as seminal.
Good and tightly. I vaguely remember watching something on ABC years ago about an old Scottish bloke having cataracts removed, and they just showed you how it all happened and how he suddenly got his vision back. And he was weeping tears of joy, and there's this really hardy old Scotsman who was just so emotional that he got his vision back. And that's something that sort of stuck in the back of my mind about, wow, that's pretty incredible how things can be changed.
The first change for David Blacker was his career choice. When he realised he would not be playing cricket for Australia or pro golf, he did medicine. In 1991, he was an intern at Sir Charles Gardner. As he describes it, early rounds with consultants who then disappeared into operating theatres, leaving their interns to care for some of the sickest patients in the hospital. But David Blacker would also learn from that legend of neurosurgery, Bryant Stokes.
About mid-afternoon you'd have a ward round, and you'd have done all your work during the day, and you'd make sure, in those days everything was x-rays and things, so you'd get all your x-rays prepared on the screen, all the scans all ready for him. You'd dash around seeing the patients again for the third or fourth time of the day. The ward clerk would get this message, he's coming in, and there'd be a hush around the ward, and we'd get everything ready. But it was great working for Bryant. He clearly wanted the best for his patients. And you want to get something done in the hospital, and you'd ring up and ask, well, can we get a scan or this or that? And there'd be someone on the other end of the phone saying, well, what do you want that for? Maybe we can do it. Mr. Stokes wants it. Sure, we'll do it now. A couple of steps this way.
Fast forward some decades. The buildings are flasher, and David Blacker is at the top of the tree.
Well, I'm a neurologist primarily, so I spend 50% of my time at Sir Charles Gardner Hospital, and I split the remainder of that between private practice and here at the Perrin Institute doing research. And I'll get you to point to which of the fingers is moving, just point to them. Stroke is still my big thing. I'm attached to the stroke pager, and so we have systems that have been organised over 20 years to enable the rapid identification of stroke patients and flow through the hospital system, and right from the point of contact at the ambulance, really.
But these days there's more than the traditional doctor-patient relationship. At Perrin, there's a three-way connection: doctor, patient and scientist.
Patients don't come in with a disease process. They have a problem. They have a symptom, and if we've got some sort of therapy that needs to be figured out at a molecular level, you need to be able to have the clever scientist going through the research steps to enable that to be created, and then it needs to be developed as a treatment. Then you need to actually test it in the human sphere, and that jump from the lab into the human is an enormously important and difficult one. It has to be taken with due caution and scientific rigour, with the patient safety in mind. Over 20 years we've seen the ability to treat acute stroke transform. We see patients who walk home after 3 or 4 days who otherwise would have been off to a nursing home or in rehabilitation for months and months and months. So that to me is still the number one thing, seeing a critically sick patient get better quickly, and there's nothing like it really.
Of course, everything worthwhile comes with a price tag, and medicine and medical research have bigger price tags than most.
We have to be grounded in reality. We've got great visions, we've got great opportunity, but we're still a small player, but we're certainly on the up. One of the opportunities here at Perrin really is that relation with philanthropic individuals to fund specific projects and programs. I think that will behove our scientists to actually make their work accessible and understandable to the public, and they're working on that at the moment, and they have to be able to sell themselves and catch enthusiasm.
David Blacker's vision for the Perrin Institute is ambitious and exciting. And for anyone pursuing neuroscience as a career, it must be seductive.
Look, I'd like to see it well recognised as a premium neuroscience research and treatment centre. I'd love to see this place buzzing with public lectures on neuroscience topics. I'd want to see people with rare conditions coming from Asia to get treatment here. I'd like our name recognised, that if you've got a bad neurological condition, Perrin is a place to come to. It's a great time to be here, frankly.